Here at Nuvior, we are the trusted distributor partnering with world-leading pharmaceutical companies to represent their cutting-edge technologies and medical devices in North America. Our mission is to bring the world's most innovative ideas, technologies, and methods to our clients, helping them grow and sustain their practices. Nuvior showcases over 20 renowned companies, including Aptos, the inventors of the world leading and longest lasting threads and methods. They have 6 times the World Award winner from the Aesthetic Medicine Award Congress held every year in Monaco. We are in the final stages of obtaining Health Canada approval this year. We also have Firia, a respected Italian pharmaceutical giant founded in 1946, specializing in hyaluronic acid injections, regenerative medicine, and joint care. We proudly offer Firia's high tissue PRP, known for its highest concentration and easy to use. There is no chances of contamination. It is a cross system and it is very easy to use and again very high concentrated. We have our medical supplies. We also offer a wide of thousands of medical supplies for your clinic, and we are committed to providing price matching to ensure our clients receive the best value. We have Dermaceutical Laboratories, which is a collaboration of French dermatologists recognized for high concentrations on advanced formulations. It is the #1 medical cosmetic pills in France, and they're a great support and complement your existing line, enhances every medical aesthetic device treatment, and they aim to help you with preparing the skin, supporting the skin during your treatments, and right post peel as well. We have our amazing Mesoaesthetics, which is from Spain. It is a pharmaceutical leader, experts in medical cosmetics and the pigmentation with their Cosmelan and their Mamelan system, created and designed in science, supported by science to give us the best science proven results. We also have Geska. Geska, we represent this German beauty tech company that we are very excited to bring on here at Nuvior. They're the leading innovator in advanced beauty technology, specializing in high quality, scientifically backed skincare devices designed to enhance and simplify personal beauty routines at a very affordable price. My name is Luis Hernandez. I am the nurse and clinical educator. I am a background in chemical engineering and I've been in the aesthetic industry for 7 years. And I'm here to support your business, to give you any time of support that you need with your one-on-one education sessions. Today, we're going to talk about our Blemiderm, which is our skincare treatment for acne. Amazing medical grade treatment that is going to battle acne from 1 to 3. Now, what is acne? Our acne vulgaris is a very skin inflammatory disease that will affect our sebaceous glands. 9.4% of the world's population is affected by this condition, and over 80% of 12 to 24-year-old individuals will suffer with acne. It is one of the most common skin conditions that we see out there. And in here in Canada, over 5 million people, nearly 20% of the population, suffer today of acne issues. It is a very, very common all over the world. It affects all skin races, all Fitzpatricks, all social conditions. It just affects everyone. It is a non discriminatory skin condition. And what age do we get acne? Actually, we get it at any age. We can even start with the newborn and breastfed babies. They can also get acne, especially related to malassezia, which is a fungal acne caused by yeast infections. It will disappear with time, but again, even babies do get it. And then the most frequent is in your teenagers. When you're getting puberty, when you start the puberty, that's where your hormones go crazy, and that's where the acne is most common, as well as we can have acne even as an adult, especially in women. It is very common that after the age of 30 or 40, we start getting acne as well. Acne, as we all know, it has a physical impact, can leave us with really bad acne scars. It has a social impact as well. When I had acne, I didn't want to go out, I didn't want to meet my friends. And it also has a psycho-emotional impact that can affect a lot of people with depression and self-esteem. What are the different degrees of severity of acne? We have 4 degrees of acne, but we will start with the acne-prone skin. Is that a skin that still doesn't have that active, really bad acne? It's just a combination of oily skin, especially in the T-zone. It has some excessive sebum, and your skin is a little oily. We have thickened and irregular texture of the skin because of the hyperkeratinization, and then we have then large pores. Normally, we will get like a localized few pimples on the face. Now, the active acne, that's a more oily, seborrheic skin. We will have excessive serum on entire the face. We will have again the thickened and irregular texture of the skin, as well as those dilated and visible pores. We will have some comedons, some whiteheads, uh, presence of non-inflammatory and inflammatory acne lesions, and we will have it constantly all over the face and sometimes even in the body as well. What are the latest scientific evidence that can trigger our acne in the dermatological congresses? So, first, our diet will be a very important trigger for acne, especially dairy products. They will stimulate the main acne pathway. At the same time, we need to have a really good gut microbiota. It is related to skin balance, to its influence in the immune system, as well that the hepatotoxicity that we can get from the antibiotics, from isotretinoin. Almost 15% of patients will have some kind of liver issues after taking this medication. Um, Known as Accutane here in Canada. That's why a lot of like we people in the medical field and the aesthetic field, we try to avoid having our patients take these kind of strong medications, because not only is going to affect your body in a physiological way, but it will also affect your mind. It will make you depressed. It will affect your mood. It will affect and disrupt your neuropsychiatric pathway. So that's what we try to help our clients first with topical treatment, teaching them how to eat, how to properly have like a good lifestyle, so we don't have to use this kind of um, invasive, I would say, medication. Now, the acne will remain in the pilosebaceous unit. So we will have our hair follicle, and then we will have the sebaceous gland with our sebocyte, which is the one that is going to produce the sebum. We have the hair follicle and the erector pili muscle, which is here. This is our skin. Now, what happened and how does acne is formed? So, just generically, we all normally shed skin, and we will the pores will be unclogged. But with acne, the pore clogs, and then the sebaceous gland starts producing sebum. The sebum cannot get out of the pore, and that's when this becomes an anaerobic environment for the C. acnes to grow. Then the bacteria will start feeding from this oil, and then it will produce a really bad inflammation, and that's where we get the acne. It's going to be hormonal, it's going to be triggered by our extrinsic factors such as the way we eat, our gut, and our lifestyle. What kind of acne are there, and what can we treat with our amazing Blemiderm treatment? So we can treat our non-inflammatory, such as blackheads. We can treat our inflammatory, such as papules, pustules, and nodules. And I would say the only thing that we would not recommend Blemiderm would be for the cystic acne. That needs a little bit more of a dermatological approach. We can still use it and we will be able to see some reduction. But again, it is mostly focused on acne 1, 2, 3. It's also going to help with the post-inflammatory hyperpigmentation that we get from acne. It's going to help with the scars and our post-snake sacral. And this is our amazing Blemiderm method. It will consist on a clinic office and then some home care products. It's intensive correction of imperfection in 2 phases. We have innovation of formulas, so highly effective active ingredients. We have new conduction systems called transcethosomes, which are capsules that will encapsulate the ingredients and deliver it better into the skin. And as always, with mesoaesthetic, we have scientific proof with clinical efficacy in vitro and ex vivo. And it is a comprehensive method, so the pack will include the office and also the home care routine. This is what we have as a comprehensive treatment for blemishes. So we will have our Blemiderm pack, which is going to regulate sebum and correct the active lesions. And then we have our Blemiderm treatment. This is our home treatment that is also going to attack that acne. We have our Blemiderm local control, which is our spot treatment. And then the Blemiderm resurfacing gel that is more for prevention and acne-prone skin, as well as our pure renewal mask and our purifying mousse. Now, our old acne treatment used to be called Acnelan. Now it has been reformulated and it has been improved, and it's called now Blemiderm. Now, Blemiderm, it is a medical grade treatment. So it is amazing. It gives amazing results. And clinics only with medical directors are able to purchase this treatment. In the kit, you're going to have the professional treatment, and then you will have the home treatment as well. Just now, with every mesoaesthetic, I would say, pack or treatment pack, we also give the home treatment. As we know, 20% of the success of the treatment is what we do here in the office, and then the other 80% is what the clients do at home every day. Now, one of the things that I love in mesostatics as a chemical engineer is that they create their own molecules. They use science to perfect their already existing ingredients, but they modify and they make it better. So they have created the blemisome complex, which it will deliver system through transcytosomes. So I was saying the transcytosome is like a capsule that will encapsulate the ingredients, and then it makes it easier for them to penetrate the skin. So they just don't stay on the surface of your skin. And with this blemisol complex, we have the oil, neem oil, which is an anti-inflammatory and antioxidant. We have retinol, which is spiral cellular turnover, and it's going to unclog the spores, is going to help with acne and pigmentation. And then we have enoxolone, which is an anti-inflammatory and also antibacterial. So it's going to help regulating the sebum production. It's going to regulate the hyperkeratinization, and it's going to regulate also cell proliferation. And it has an anti-inflammatory action as well. As always, here we have some before and after of our patients. We can see how the acne lesions are diminished, as well as our vascular and post-inflammatory hyperpigmentation after acne. This is day 0 and this is day 90. Look at what such a big change. Again, 90 days of treatment, and we can see that just in 90 days how much the acne has been reduced, and also the vascular pigmentation and the post-inflammatory hyperpigmentation. Now, what is in our Blemiderm pack? So we have 3 vials of our Blemiderm Pre-Peel. We have 3 bottles of the Blemiderm mask, 1 post-pill neutralizing spray. So the course of the treatment is going to be 3 treatments. And then we have the home pack. In the home pack, we have the purifying mousse and then the Blemiderm treatment. This is what the clients will take home to use. Now, let's start with the Pre-Peel, the Blemiderm Pre-Peel solution. It's a keratolytic and sebum regulating peel. So it's going to be in our exfoliating solution. It's going to prep the skin. It's going to exfoliate. So our Blemiderm mask ingredients are going to penetrate better and give you the best results ever. So it's going to reduce hyperkeratinization of the skin. It's going to unclog the pores, allowing the active ingredients to penetrate. It's going to eliminate excess sebum, and it's also going to regulate sebum, and it will promote epidermal renewal and will stimulate collagen and elastin. What are the ingredients in our Blemiderm Pre-Peel? We have retinol, we have bakuchiol, which, as we know, it is a retinol plant-based. We have our salicylic acid that is going to exfoliate, mandelic acid, phytic acid, glycolic acid, caffeic acid, and succinic acid. These are all going to help with the hyperkeratinization, and it's going to help with sebum regulation. After that, we will apply our intensive corrective mask, our Blemiderm Star. It is an anti-perfection face mask. It's going to help reduce the hyperkeratinization and the pore clogging. So it's going to unblock the pores. It's going to eliminate excess sebum. It's going to initiate a sebum regulator action, and it's going to reduce the swelling, and it's going to help with the inflammation of the skin. So it has an anti-inflammatory action. It has the blemisome complex that, as I was mentioning before, it has the vehicle delivery system using transcytosomes. So this is going to help deliver the ingredients in a much better way, more efficient, and it has a direct action on the pilosebaceous unit. What are our ingredients? We have the blemisome complex that again is going to help with hyperkeratinization. SIBO regulation, and it's also a very good anti-inflammatory. We have the pyruvic acid, mandelic acid, which is also a very good antibacterial, salicylic acid, exfoliating, and shikimic acid. This is a new acid comes from mushrooms that it's going to help as well with the hyperkeratinization. And then we have kaolin and sulfur. Now, after these ingredients, as we know, they're quite very spicy, so we use a post-pill neutralizing spray. So this is going to soothe the skin, it's going to neutralize the skin, and it's going to help also as an anti-inflammatory. So it's going to rebalance the skin and soothe the skin. And the ingredients is just sodium bicarbonate and aloe vera extract, and the pH of this post-pill neutralizing is 8.6, so it's very alkaline. In order for us to complete a full treatment cycle, we normally recommend to give the total of 90 days to your patients for them to be able to see the full result. So we're going to do one treatment every 15 days. So in total, 3 treatments we will do with this pack, with the Blemiderm pack, 15 days in between. And then they will continue using the home products right after each treatment. So after 24 to 48 hours of we performing the treatment, the Blemiderm, the skin once it's recovered and it's back to normal, we're going to start using our home products. Ideally, 3 treatments are necessary, but in some people that have very stubborn acne, we can do a fourth session 15 days after as well. It is recommended to do 2 of these Blemiderm packs a year in order to maintain the results and keep the acne under control. So, what is the protocol? Again, we will start with 3 sessions of the treatment, 15 days apart, and then we will send our patients with their home kit. And then we will also add some supporting products that is going to help hydrate, that is going to help soothe the skin. Using the supporting products is extremely important because some skins were going to get dry and sensitive, and we have products that are going to help every kind of I would say reaction after the treatment. Now, what are the treatment support? So we have the Blemiderm treatment. This one is included in your Blemiderm pack, and this is a treatment for active acne. It's going to help regulate sebum and correct lesions. Now we have the Blemiderm resurfacing, which is more for acne-prone skin, just to prevent acne, people with very few pimples, just to help maintain acne under control. And then we have the Blemiderm local control. That's our spot treatment for when we get those pimples that are very stubborn. This is a recommended treatment routine for our patients at home, depending of the acne that they have. So for acne-prone skin, we will use the purifying mousse. We will start at night first, and if tolerated, we can use it twice a day. Then we have the Blemiderm resurfacing. Again, this is for people that is just only acne-prone, that their acne is not active, and they just want to prevent getting more acne and just controlling 1 or 2 pimples. And then we have the Blemiderm local control. That one is very important. We need it when we get like a few lesions, we can put it in there. Then for people with active acne, we recommend again the purifying mousse. They can use it up to twice a day. And then the Blemiderm treatment. This is a little bit stronger formulation for, again, clients with active acne, and then the Blemiderm local control, which is our spot treatment. Now, with our Blemi Clear Complex, which is our exclusive complex for our Blemiderm, what are we going to do with these ingredients? We're going to control our hormones. So it's going to inhibit an enzymes that control the hormone pathways. It also has an antibacterial action and microbial rebalancing. So it's going to inhibit the formation of the C. acnes and it's going to increase the presence of beneficial bacteria. It also has anti-inflammatory actions. So it's going to inhibit the main enzymes involved in the inflammatory process. And it's also going to regulate sebum, so reduces the hyperstimulation of the sebaceous gland. Now, other active ingredients in our home care products will be azelaic acid. So, as we know, azelaic acid is going to help sebum regulating, it's going to renew the skin, it has a really good antibacterial action and anti inflammatory. Then we have our liposomal retinol, which again is a retinol that has been encapsulated, so it works much, much better. We have our enoxolone, which is an anti inflammatory action. And then we have our AHAs, BHAs, and PHAs, such as glycolic acid, mandelic acid, salicylic, and gluconolactone, that is going to help regulate sebum and is going to help exfoliate and it's going to help renew the skin. And our shikimic acid, that again is going to help with sebum regulating and skin renewal as well. So we have an amazing combination of active ingredients that are going to work synergistically to give us that beautiful results that we need. Now, just to get a little bit more in detail of each of the products, we have the Blemiderm treatment. This is again our product that is the clients are going to use every night, only once a day, every night, all over the skin. And it has liposomal retinol, it has 10% azelaic acid and shikimic acid, and it has mandelic acid and salicylic acid. So it's just going to help with the skin renewal and will regulate the skin. And as always, we recommend to use SPF minimum of 50 every single day. So this treatment is going to help unclog the pore and reduce the excess sebum. Now we have our Blemiderm local control. Our Blemiderm local control is an active acne treatment. It is just a spot treatment. It's a concentrate gel that reduces the localized imperfections. So we have alpha hydroxy acids and beta hydroxy acid, such as mandelic acid, glycolic acid, and salicylic acid, that is going to help with the skin renewal. We also have an anti-inflammatories such as enoxolone and niacinamide that are going to hydrate and prevent the appearance of post-inflammatory hyperpigmentation. Enoxolone is going to reduce epidermal redness and swelling. And then we have also our microbial rebalancing, our Maclura quinquensis. And again, we can apply this at night on the imperfections as well. We only need a little bit. It's a small tube, so it's just very localized. We have our Blemiderm resurfacing gel. As we were saying, this works for people with acne-prone skin. So it's a preventative treatment. It's going to refine the pores, purifying the skin texture. It has a combination of salicylic acid, glycolic acid, and gluconolactone that is going to, again, skin renewal, exfoliate, and regulate the sebum production. And it has our Blemi-Clear complex that is going to help with the hormonal imbalances, is going to help with the anti-inflammatory action. It has microbial rebalancing as well, and it's going to regulate sebum. We will use this daily, once a night. And in case that our skin gets too irritated, then we should use it every other night. Our face wash, we need to use our face wash every night, remove makeup, clean the skin from all the pollution, from all the oil. So we have our purifying mousse, which is a balancing and anti-pollution cleansing foam. So it has a characteristic and purifying active ingredients. We have chlorhexidine, which is an antiseptic. We have salicylic acid that again is going to help with anti-inflammatory. It's going to help with regulate sebum and is comedolytic. And then we have lactic acid, that is an alpha hydroxy acid that reduces the thickness of the stratum corneum. We have our biobalancing action with the lactobacillus ferment, and then we have our urban detox, which is a biotechnological ingredient of plant origin capable of deeply removing pollution particles deposited in the skin. It is going to be a light foam, so when you mix it and just few pumps, it has that very nice texture. It has menthol on it, so it's going to feel very fresh. It is suitable for oily and acne prone skin, and we can use it morning and evening. We recommend that we start using it in the evening first, excuse me, and then increase as tolerated. Other supporting products, we have our pure renewing mask. This mask is going to exfoliate and cleanse the pores to prevent and attenuate imperfections. So we have kaolin, which is a white clay, uh, which is quite highly concentrated, and it's going to immediately purify the skin, and it's going to absorb the excess oil on the skin. Then we have again our alpha hydroxy acid and beta hydroxy acids that is going to help with the keratinization of the skin, and it's going to exfoliate and unclog the pores. It also will help with physical exfoliation because after the 15 minutes, it's going to get a little solid. So with a little bit of water, you start like removing it, and it will help with physical exfoliation as well. Again, we will just apply it all over the face. We leave it act for 10 to 15 minutes, and then we will remove it with water. We can use it between 1 to 2 times a week, and it's non-comedogenic. Now, our favorite supporting products. These are something that every patient on Blemiderm should be using. So we need daily hydration because again, just because our skin is oily doesn't mean that we don't need a moisturizer, doesn't mean that we don't need to hydrate the skin. So on the contrary, sometimes because people attack acne so strong and they over dry their skin, then their skin needs to produce even more oil to try to balance it out. So we have our HA Densimatrix, which is an amazing hyaluronic acid hydrator with 4 different kind of hyaluronic acids. So it's going to hydrate all layers of in the skin. We have our Hydra Vital Light Moisturizer. So it is a very light moisturizer with really, really nice cooling effect. So it's going to calm the skin, it's going to hydrate it. Now, for patients that have very red, inflamed skin, we recommend the skin balance. We call it the 911 of the skin. So anytime that your skin is in an emergency, you apply this serum and it's going to calm down the skin. It's help with anti-inflammatory. It helps with redness. So it's really good for any kind of irritated skin, especially after any kind of treatment. And of course, our sunscreen, our Mesoprotect sunscreen 50 SPF, but in reality, it protects 1/3 of all UV rays, including the blue light from our devices, our cell phone, our computers. Now, this is the end of our amazing Blemiderm pack. So we're going to free the skin from all our blemishes. Again, it is a new generation of solutions that multilaterally addresses acne lesions and remove skin impurities and blemishes. Their formulas, they have high tolerance on the skin, tested by dermatologists and backed by in vitro evidence and clinical studies. So we will be able to see visible results from the most exigent skincare experts. Thank you, everyone, for being here today. And again,